I was born in China. We immigrated to the U.S. when I was real young. I'm 3. We lived in Massachusetts for a few years, then to Tennessee, and then ultimately I spent the majority of my adult life in New Orleans. I did my medical training there, and I did my fellowship in Louisville, Kentucky, and I stayed on as faculty there for a training program. Since that time, my family has grown, and I have had to relocate to be closer to family. And when I was searching for a group to join, Crystal Clinic clearly stood out as a leader in the field, and I feel very fortunate to be on board. What drew me into medicine initially was both my parents used to work at the hospital in China when I was real young, and I was able to see kind of what they did from a very early age. And once we got here, some family members had a few health problems, so I spent a lot of my time around seeking treatment for them, and it made me feel really happy that there are people that were able to take care of my family members and help them improve themselves. What drew me to the Crystal Clinic is that, one, this is a renowned institution with leading care in innovation and patient satisfaction, and all doctors want to participate in a facility that's able to deliver this. The resources here are unparalleled, that patients can get what they need instantly without having to be referred out. We can keep everything in-house and streamline for the patient. What I like most about the role here is that we get to give patients their lives back. It's not often thought about how much you use your hands on a daily basis because it's so natural. But once you lose the ability to do what you love on a daily basis or to work, it becomes a big deal. And here we get to restore that. I had a gentleman, he was very young, in his 40s, who cut off his thumb rebuilding his house. Since he came in, we put it back on, and he's now able to return to his work as a carpenter and regain not only his livelihood, but also full function of his hand. Outside of work, I think my favorite activities are probably cooking and taking care of the baby now. So my wife's very good at making Italian food and baking, whereas I, with grandma's influence, I like to dabble in Chinese cooking, but again, not quite as good as grandma, but I do my best. I think what's important for patients to know is that when they have some discomfort or ailment of the hand, whether it be a finger that hurts or some numbness or tingling, these are not things that you have to live with. When you are just surviving, sometimes it's not enough. And I think that what we can do, especially in hand surgery, is make sure that not only are you surviving, but thriving. And that's really what we strive to do here.